Hi, everybody, and welcome to our second Related Service Providers Community of Practice meeting. We're going to focus today on teleservice. I'm Andrea Bertoni. I am Speech and Language and Related Service Consultant for DPI, Department of Public Instruction. I am joined today by Carlin Higbee, who is an occupational therapist and who we are very fortunate to have with us today as a co-facilitator during all of these community of practice meetings. We are also joined by Jess Nichols, who is the Early Childhood Statewide Coordinator for Equitable Multi-Level System of Support. You will hear from everyone today, and they can introduce themselves during that point if they would like. I want to thank the Wisconsin Statewide Parent Educator Initiative, or WISPE, for letting us use their Zoom platform today. And again, here are a link to resources for today. Jess put the link to the participant folder in the chat, and we'll do that again, as well as the Padlet. People had asked for a place to put resources. I had sent that in an email, and we also have a link here that we will be sharing with you in the chat. All of these meetings are recorded, and we will be posting them onto the Collaborative Special Education Support Professional Learning Events page. We want to take a moment here at the beginning and have a brief pause, a land acknowledgement. We have 11 federally recognized nations in Wisconsin, in addition to the Brothertown Nation, which has been fighting to acquire federal recognition for almost 200 years. And you come to us from all over the state, and I'm going to pause just briefly for a moment for a brief land acknowledgement, just acknowledging that there are people that came before us. And I'm going to also put in the chat a resource for you. One of my colleagues, David O'Connor, who is the Native American education consultant for DPI, has an article about teaching culturally versus teaching culture. So I encourage you to look at that and share that with others when you get a chance. So we're really excited to be doing these community of practice meetings, and we identified our three major purposes. We want to make sure that we provide information, guidance, and share the most up-to-date information from our end, from the DPI lens. We'll make sure that we're focusing on how we can support students with the lens of equity, and we want to emphasize the educational relevance to our work since we are working in school-based settings. The other purpose is we want to help you share ideas, resources, and collaborate with one another. That is why we're going to try to spend at least 20 minutes every time in breakout rooms so that you can connect with other people. And then the third goal or purpose of the meetings is that you'll be able to share information and resources from the meetings to support students, families, and educators. Here is our loose agenda for the day. We are going to start and end with some self-care ideas and or activities. Then we're going to talk briefly about teleservice best practices. I'm going to share a little bit about UDL resources that you can incorporate into your work and share with others. And then we'll do our breakout discussion before ending with self-care. And I'm going to turn it over to Carlin.
Thanks, Andrea. Welcome, everybody. Good morning, or almost good afternoon, I guess. So, you know, one of the things that we are going to try to think about at each session is just the self-care. A number of us are tired and pulled in a million different directions and trying very hard to stay consistent with best practices as we're working in these rather chaotic environments. So this is just a fun thing that was a nice reminder for me. And we thought we would share this with you today. And I think I just have to say it's one of the pluses of Facebook. So maybe other people have seen this, but I thought it was really good to share today. This is one of the slides we're using to kind of talk about, as I indicated in the earlier slide, we have a number of things pulling at us as we think about our service delivery right now. Not only service delivery, if your district is still face-to-face, and how we keep safe and how we're keeping children safe and our colleagues safe, but also that whole idea of the IDEA and DPI guidance around, how do we ensure FAPE and LRE as we consider the ways that we're providing services in the pandemic, whether it's virtually or face-to-face. We want to think about evidence-based practices, and then that equity piece, which we hope to provide some information about that every session so that we can just expand our thinking, and hopefully you'll take that to your teams. In certain parts of our state, the equity related to education is very difficult. And then there's the challenge of our own capacity that kind of clouds, sheds cloud over all of these different kinds of things as we consider what we're doing. So be mindful of that. And we know that you are all trying your very best. These are some of the words that you used last time when we asked for how you're feeling. And we asked you to take a word and describe your thoughts and feelings that day. And this is a good representation of it.
Right, just take a second and look at that. A lot of strong feelings and words in this.
And I always think this is probably how our children are feeling, and our teacher colleagues and their parents. So when we talk about best practices, I have a great little quote here from Theodore Roosevelt, which I just keep telling myself, you do what you can with what you have where you are. And we just need to kind of hold that thought in our heads as we go through each day. But we are mindful of, again, those evidence-based interventions within the context of cultural sensitivities, team collaboration, and we have some resources for you around that today. The use of our own clinical reasoning skills as we select interventions that may not have significant evidence for virtual learning settings, but we know they have strong evidence in other settings, and how do we use our clinical reasoning skills to make good decisions about that. One of the strong evidence-based supported intervention for both assessment and intervention is something called routines-based assessment, and you're probably hearing about that in a number of different areas. It's something that the EC team has been, in DPI, has been kind of grounding their work in that area as well. So we've got some resources on that. And then we also have a parent caregiver coaching resource that comes from AOTA. Those resources will be in the Padlet after today's presentation, mainly because I'm still learning how to do that. So we'll make sure those are there for you at the end of today's session. The other thing is that we want to be sure that in our own approach and how we document things and how we consider things, that we're continuing to look at that educational relevance. As we talked about last time, I think all of us have been kind of thrown for a loop in trying to meet IEP minutes and figuring out how to best do this. And now, as we have some time to catch our breath, to be thoughtful about maybe direct service is not the most educationally relevant way to support this child in a virtual setting, and to be thoughtful about how we develop those contingency plans, particularly in those districts where you're still providing face-to-face education, and then allowing for a contingency plan in the event of a school closure. And that's one of the things that DPI has recommended in terms of languaging specific ideas around that in the program summary page, as well as thinking about the goals that you're writing. Are they going to be able to be met, and can you collect data in a meaningful way in the home if we do have to go to virtual learning? And if not, maybe to use that I-10 process to make those changes, which we have some latitude from DPI to do that now, so that we can make sure we are providing the most educationally relevant services. But again, using your head and thinking about our clinical reasoning skills, as I said before, there's limited research that we can rely on right now for virtual instruction. And so use your head, think about where you want this student to be and what's really important for them, and do that in the context of your whole team. Try to find as many ways. I think we sometimes are feeling right now that we are left behind because everyone's scurrying, and what's happening across the state as I talk to people is we're kind of falling back into that siloed mindset of how we're providing services and interventions. So You might be the one who has to go to your team and say, can we think about this? I have some neat ways that we might be able to do this. It's better for the student and easier for all of us. And Andrea, you were going to say something about the Facebook groups.
I did. I put them in the chat. SLPs, if you're looking for evidence-based practice or groups that are really committed to thinking about evidence-based practice via Teleservice, I put 3 different Facebook groups that I think are worth checking out. SLPs for evidence-based practice, the SLP Telecon Facebook group. That was a free conference that was held last spring and is no longer accessible, but they still have a Facebook group. And I think that they ask really good questions and bring up important topics. And then there's the Facebook group Clinical Research for SLPs. And my favorite, Meredith Harold, who is the author of The Informed SLP, she posts in there quite often too. So I encourage you to check those out in all your free time. And actually, Sue Adamo just shared that there's an OTPT Facebook page, and she added it to the Padlet. So thanks, Sue.
Great. So I think we've talked about this before. And so those of you who attended the CISA 1 a couple of years ago had an opportunity to meet Carlo and are familiar with the Seek Freaks page, but there's a great page there that specifically talks about interventions that work in teletherapy, or as we refer to it as teleservice. And this is a very helpful resource. So we just wanted to put that in again as a reminder. And there is a link to share that Andrea has as well.
Yep, I have an additional resource I'm going to put in the chat right now from Seek Freaks. It's free resources for OT, PT, and speech services during the COVID-19 pandemic.
This is another resources. We've talked about that routines-based assessment, and I know that the Seek Freak page refers to routines-based assessment and intervention services and intervention support. But this is a great thing. The routines-based assessment that was initially the concept developed by a guy named McWilliam was for doing routines-based assessment with early childhood kids and working with their parents. But they have, this Vanderbilt University has developed one that is a scale that you can use with teachers to look at routines within the classroom setting and the school setting. I highly recommend this one. They do have a fillable document that you can use electronically. But if you're really even outside of the COVID world we're living in, if you are interested in pursuing how you can do better strengths-based assessments and ones that start first and foremost looking at the child's function within the school setting, this is a great tool. So that will also be available for you in the Padlet. All right, so the medical necessity piece. Okay, so first of all, I think we need to have a little disclaimer here as we talk about this. DPI, this is tricky because DPI does not regulate what's billable and what's not, but there has been some confusion over teleservice due to how DHS guidance initially last spring was languaged, and then some further rigidity interpretation through some of the billing software providers. So rest assured, we are working on clarifying this. There's a stakeholders meeting coming up early December, and DPI representatives and stakeholders in OT and PT and speech therapy will also be a part of that conversation with DHS, and we're going to try to get some clarification. But there are a couple of things to think about as you're documenting your service. First of all, remember that in Wisconsin, medical necessity is decided by, one, that the medical necessity criteria is met simply because the IEP team has determined that the child needs it for their education. And two, it has to be provided by someone with medical expertise. So just simply practicing something is not skilled therapy intervention. That might not mean that you've spent a session practicing on something, but it wouldn't be billable, and that's fine. The important part is to make sure that you've talked about the possibility of virtual instruction in your contingency plan. And in that, you may want to mention that one of your intervention models or intervention techniques will be parent coaching. And if you think about it from the context of, a couple examples I use. So if you're working in birth to 3 and you're working on feeding, you are going to spend some time coaching a parent how to position the child, how to position what proper kinds of utensils to use, maybe oral motor issues, and that session would be billable. So the same reasoning, we are wanting to make sure that they clarify this through DHS, the same reasoning would apply. If we are working with a student virtually and the parent is there and we are coaching the parent specifically to do certain things with child to reach an outcome, then we need to be sure we're documenting carefully that our clinical judgment was used in that situation, that we made ongoing assessment and adjustments based on feedback of what we were seeing and the parent's level of comfort and the student's performance, and then that would be the type of documentation you would need to support medical necessity. So this is just a nice little slide that's been adapted from a webinar that I attended, but this is a nice decision tree that you can use to kind of think through whether or not it's potentially a billable service. And again, I want to remind you all that you might need to remind your special ed directors, we don't have productivity standards in this school. You know, Medicaid is a second thought. Our primary focus is providing educational services. If they happen to be billable and meet the standard for medical necessity in terms of billability, that's frosting on the cake, but that's not what primarily drives us. So for some students, if a distance learning plan is better and it's better for the family and for the student that the entire team collaborates and creates that distance learning plan, we are providing the appropriate service, but that would not be a billable service. So this is a nice decision tree to help you think through what might be billable and what might not be.